We're going to move on now with Dr. Janet Helms, our next speaker. Dr. Helms is the Augustus Long Professor in the Department of Counseling, Developmental, and Educational Psychology, and the Director for the Study and Promotion of Race and Culture at Boston University. She has held many offices, received many honors. She's been the past president of Division 17 in the American Psychological Association, the Counseling Psychology Division. She is a fellow in both counseling psychology and ethnic minority psychology, and a member of the Association of Black Psychologists. She has been a leader, probably the leader, in the development of theoretical understandings and research on racial identity development among both whites and persons of color. She is a very distinguished psychometrician scholar, scholar of assessment and psychological assessment, and carefully considering the challenging issues of diversity as it relates to psychological assessment and measurement and what we claim to know. She's done impeccable science and with a very strong critical awareness of how diversity issues can get marginalized. She's the author of many publications and 4 books, including Race is a Nice Thing to Have and Using Race and Culture in Counseling and Psychotherapy. And we are both alums of Iowa State University. I had to work that in there. I know that there's at least some University of Iowa fans in the group, so I needed to acknowledge that. So thank you, Dr. Helms. Please come.
Thank you, Steve. Good morning. In my culture, which is indigenous African American culture, there is a belief that if you bid someone good morning and they bid it back to you, then you won't do them harm and they won't do you harm. So since I'm going to be talking about issues that ordinarily we don't talk about in socially acceptable settings, I need a better good morning than that. So let's try this again. Good morning.
Good morning.
Thank you very much. Now we have a commitment to each other. Let me do my caveats first. The first is that I intend to traumatize you just a little. But the problem is, we've all been traumatized just a little, so I'm not sure how that's going to work, but we'll play it by ear and see. The second is that machines hate me, so I'm not sure if this machine is going to work. And the third one is a Mac, so I may have a Mac attack at any moment. Other than that, let's get started. One of the things that I try to do in my work is to give us a language for talking about tough issues. In our society, talking about race and culture are tough issues. And so I'd like to begin by giving us a sense of what race is in our society and what culture is in our society. And most of my students will tell you, I don't like to do all the work by myself. And so I'm going to ask you to join me in a little activity. This will make you lots of friends. I want you to think about when you were maybe 8 years old. You can do it. And you were ill. Who was the nurturing person in your environment who tried to make you feel better? When they tried to make you feel better, what did they do? Maybe it was a mother or a father or a grandparent or a teacher, whoever it was who nurtured you when you were ill. Do you have something? Okay, share it with the person sitting next to you. And if no one is sitting next to you, move close to someone. You need a friend. Okay, can I get you to pause in your sharing? Did you notice, what did you notice about the climate as you were talking to each other? Did you notice that you were all happy, that you were laughing, that you didn't seem to have a great deal of difficulty communicating with each other? What you've done is that you've just shared a small aspect of your culture, your ethnic culture. Ethnic cultures exist to help us survive, and they're where our warm memories tend to come from. Now, it isn't the case that ethnic culture is not affected by violence, but usually when we talk about ethnic culture, we're talking about customs and beliefs. Now what I'd like you to do is to think back to the time when you first discovered what race the society thinks you are. Got something? Share that with your new best friend.
Do you want to advance this slide?
Yes. It should be on that one now. Okay, stop sharing. I know it's hard. I don't know if you noticed, but from where I am, the conversation was much more subdued. And if I ask you why, well, maybe I'll ask you why. Why was your conversation more subdued? Any takers? Say, I heard a voice.
It was painful.
Okay, it was painful. I saw a hand. What's that?
Yeah, I was thinking of all like the racial slurs that I heard, or jokes
It was
about black people.
It was painful, racial slurs, jokes about black people. Okay, so we began to see that there's a difference in how we think about race and how we think about culture. But in fact, we often talk about these things as though they are the same. Here's how I think about ethnic culture or ethnicity. In our society, it's very important. It's how we communicate with each other, and it's how we understand the world. All of our socialization experiences begin with culture. It is so important in our lives that we totally ignore that it exists. But it's the values, it's the customs, it's the language that these things are transmitted from generation to generation, and we hold on to them, we value them, we can talk about them. They bring warm feelings to us when we think about them. People who look different, and therefore might be classified as different racial groups, may share the same elements of culture. We talk about Black Hispanics or Black Latino Latinas, for example. They share language with Hispanics who are Asian or white or other racial classifications. So people don't have to look the same in order to share an ethnic culture. Often our culture is invisible. And so if someone asks us to describe it, we maybe can't do that. But it becomes automatic. It's an automatic part of our socialization. And so we practice culture even when we don't know that we're doing that. Culture is important. Culture is often a source of ethno-violence, both here and in other countries. But I'm not going to talk about ethnic culture. Instead, today I'm going to talk about maybe race. Race. In US society, race is probably more important than culture, at least in terms of how the social systems work. But race is essentially a meaningless construct. It's externally defined, so social policies, laws, or customs decide who belongs to which racial group. And as the system needs people to belong to different racial groups, it changes itself so that different people belong to different racial groups. For example, we have what we call in the United States the white ethnics. The white ethnics are people who originally were treated as if they were black people in the United States. But as the country became more needy in terms of workers, what it did was to incorporate those groups into the white group. And so there are permeable boundaries by which we define race. There are no explicit behaviors, values, or so forth that define the members who are assigned to a particular racial group. Rather, we assign them to a group and then we infer that there are certain characteristics that they acquire as a result of belonging to those groups. We do, in fact, understand that, or maybe we don't, but we should understand that racial groups are socio-political constructs, and I could probably add economic in there. What they do is they help us maintain a status hierarchy within the society. We treat people differently, and we justify why we treat them because we say, in effect, we're treating them differently because of their racial characteristics. By the way, I don't know what I'm doing about time. Is someone going to let me know? We don't really have a shared language for talking about race, and so therefore we don't have a language for talking about racism. So this is kind of the definition that I use. I think about racism as the use of socio-political and economic power. What it does is to maintain the advantage status of the dominant group over non-dominant groups. In fact, races in the United States became viable because the dominant, certainly power group in the society, wanted to maintain its power. Consistent with the social psychologist James Jones, I talk about different kinds of racism, which we often don't do. One kind of racism is institutional. So the laws, the customs, the social policies used to wield power are what I think about as institutional racism. So the law that says, for example, it's okay to stop young men of color and search them because you think they look suspicious is an example of institutional racism. The Supreme Court, who says we don't need a Voting Rights Act, is engaging in institutional racism. So racism may occur at the institutional level. We often think about institutional racism as something that we can't do anything about, but recognize that institutional racism grew out of individuals making decisions about how our society and our world should work. Individual racism, or the microaggressions, that is the small everyday assaults that happen in a person's life that are committed at the level of person to person and are intended to damage the integrity of the person. Sometimes this is intentional and sometimes it's automatic and accidental. For example, I can ride a bus whenever I want to and have a whole seat to myself. No one will sit next to me. Why won't they sit next to me? I suppose they think that I am going to attack them, which I guess I could. That's a microaggression, and microaggressions build up over time. And then there is cultural racism, which is putting down the products and characteristics of the minority status group. For example, interestingly, we use quote unquote black slang in many aspects of our lives. We couldn't have sporting events like basketball and football if there were not black quote unquote language. But when it comes to SATs or GREs, none of those words appear. What we're saying in effect is that one culture's words indicate intelligence and achievement orientations, and another culture's words do not. even though many people use the quote-unquote black language more than they do the white language, particularly when talking about issues of emotion. We categorize people according to their race rather than their roles. So President Obama is a black leader. He's not a politician. He's not a black politician. So we classify people according to racial labels. Each of these kinds of racism occurs every day and may in fact result in trauma to the people who are experiencing these events as well as the people who are perpetrating them. We don't have any research, or very little research, I should say, or interventions that's specifically focus on racial trauma, the extent to which how we treat people because of the racial groups we think they belong to affects how they feel, their mental health status, and so forth. In general, when we think about racial trauma research, and if you search the clinical intervention literature, what you will find is that it focuses on comparing racial ethnic groups with each other without regard to trauma as a precipitant of the person's experiences. So people may tell you, for instance, that Asian Americans who fought Asian people during one of the last wars had higher levels of trauma following that experience than did white people who fought during the war. But they don't tell you to what extent being an Asian person in the Army was a problem for the Asian people, that they were in fact, the Asian American people, they were in fact harassed by their fellow warriors, if you will. In studies that involve black samples, very much what one sees is that researchers study perceived discrimination. And they find that it's related to various health indicators, including poor cardiovascular health, higher levels of anxiety and depression. But the interesting thing about this research, of which I've tried to do quite a bit, is that what I call the gatekeepers of our mental health research do not believe that black people experience discrimination. And so I will often get comments from reviewers that will say, in effect, how do you know they're not paranoid? How do you know they're not just imagining that they have experienced racial discrimination? After all, you're using self-report measures, and maybe they're not reporting accurately what happens. You need to be able to go out and find out that they are actually experiencing the racism that they describe. Well, in fact, most of psychological research and health interventions are based on self-report. We don't say, how do you know that the person is really experiencing symptoms of depression? You need to go out and see if they are. We don't say, how do you know that the person is experiencing symptoms of anxiety? You need to go out and prove that they are. What happens in effect is that when we think about race, we can't accept that racism occurs in the society and that it affects people's mental health status. I would argue that it also affects the mental health status of the people who are not the obvious victims of racism. How can you, what is the consequence of separating how we perceive people based on their race, not only to the victims, but also to the people who often are not victims of that kind of experience? In our literature, we talk about post-traumatic stress syndrome, and we talk about stressors. In general, when we're talking about stressors, we're talking about psychobiological responses to a traumatic event. And we all probably pretty much, at least those who are clinicians, know that some of the characteristics are that the person will have a physiological and psychological re-experiencing of the event. So it's not unusual, for instance, to hear about the veterans who are coming back from the wars who have traumatic reactions, psychological reactions to having been in the war. It's not unusual to hear about the veterans re-experiencing the event. In fact, one of the treatments that now seems to be popular is actually having them re-experience the event over and over again until it does not trigger the same kinds of symptoms. PTSD, we know that often involves avoiding stimuli perceived to be associated with a traumatic event. For women, for instance, we're beginning to talk about traumatic race syndrome. We know that for women who have that experience, it's very difficult for them to go back to the settings in which they experienced that trauma. And then a third kind of symptom is increased and persistent arousal. You are always on the lookout for where and how this event will happen in your life again. If the event happens regularly, that means that you're always on the lookout for how this event will happen in your life. One does not necessarily have traumatic reactions to stress or to stressors, but the traditional PTSD definition gives us an idea of what kinds of events traditional society thinks about as stressors. So we recognize, for example, that any event that threatens the person's integrity, physical integrity of themselves or significant others in their life, potentially can elicit traumatic stress reactions. We understand, for example, that major events like car accidents, war, crashes, rape, violence, all of those things can potentially trigger traumatic reactions. We also understand that for some people, they can go through the same experiences and not come out with PTSD symptoms, but for other people, they may experience the events maybe even only once, and they may develop the PTSD kinds of symptoms. So I contend that racial or cultural events may contribute to major life stress or trauma. And I think about, for example, it's not hard to think about racial or ethnically based events in one's life as being threatening. We have a long history of murderous assaults against people of color. We have a long history of threatened death or serious injury. And it's not as though this history is in the past, because we can see it every day in the lives of many people of color in our country. Racial or cultural events that may contribute to stress may involve endangerment of significant others. It does not have to be one's own racial trauma event that contributes to the symptoms. It can be watching members of one's own racial or cultural group experience those kinds of incidences in one's life. It is traumatic if it causes the person to re-experience that event, even if the treating person, the clinician or the observing person, society, does not consider it traumatic. It may be traumatic for the person who is presenting, because for that person, it occurs in a historical past or a historical present. And without understanding that, then we can't understand how racial or cultural events contribute to life stress. And it may occur as additive, so that often people cannot talk about a major traumatic event that happened in their lives, but they can talk about many microaggressions, minor events that occur in their life. And these may add up to symptoms that are very similar to PTSD symptoms. So these are some of the symptoms that I think are associated with person-level racism or microaggressions. Cognitive impairments. People who have had traumatic events occur in their life that they perceive as traumatic often have memory losses. They often cannot describe what the event was, they just know that it was a very stressful event. Sometimes what people who have this kind of experience have intrusive thoughts. The event keeps reoccurring in their minds, in their lives, no matter how much they try to push it away. They may have somatic symptoms. Some of the common ones are headaches and body pains. But what we also don't acknowledge is that some kinds of symptoms that we don't think about as stress-related, such as high blood pressure, such as obesity, such as cardiovascular disorders, may actually be responses to racial trauma. Interestingly, the tendency of people who experience microaggressions is to blame themselves. They begin to lose their self-confidence. When no one would sit next to me, I began to wonder, well, do I need to use a different kind of deodorant? What's happening here? The tendency is to look inward rather than to recognize that, in fact, what's happened is occurring outward. And often that's because we socialize people, regardless of their race, ethnicity, to not think about race as a potential cause of our life experiences. People who experience traumatic events often develop affective symptoms, such as confusion or shame. One of my former doctoral students went in for a job interview, she's Asian American, at one of the VAs. Her research is looking at how racism affects Asian Americans' physical and mental health. When she tried to discuss this research at the VA for her job interview, they told her that it was ridiculous to study those issues. She wasn't a real psychologist, she ought to go into social policy work. She left that interview with enough self-esteem to call me up and say, what did I do wrong? And then my job was to help her recognize that she was not wrong, that it was a system that was unresponsive to her that was wrong. So now I'm going to give you just a little taste of racial trauma.
We are beginning tonight with a very fatal standoff. It happened between Salinas cops and a man that was armed with garden shears.
Tonight, though, there are questions being asked about whether Salinas PD needed to use excessive force.
Problem with me, you get it. Seriously, one problem with me, you get it. Go ahead. Go ahead. Go ahead. You get it. The both of you. Seriously, I'm quick. Serious.
You see that? Did you see that? Kicked him in his chest.
The American people reminded us that while our road has been hard, while our journey has been long, we have picked ourselves up. We have fought our way back. And we know in our hearts that for the United States of America, the best is yet to come.
A homeowner shot Renisha McBride on his porch, called it an accident, but some now believe that race may have played a role in the killing.
So you think he's yelling help?
Yes.
All right, what is your...
The mood of the crowd that gathered moments after the shooting was at times tense and emotional. Several in the crowd yelled at officers and questioned whether race was a factor in this and the Mi Pueblo incident.
Is that nearly
happened, well, I was coming from school. I was right there when I heard 4 gunshots. I was like, what the hell happened? And then I see my own race, my own kind, shot dead on the floor. That's not right, man.
The suspect appears to be impaired in some way.
And we want to warn you that we're going to stop this video before the moment of death, just to try to be sensitive to the timing, what time it is, and that perhaps young children may be watching. But this is right there is when 4 gunshots went off and the suspect was shot dead.
When you try me with a sorry receiver like Crabtree, that's the result you're gonna get. Don't you ever talk about me.
Serious. Fuck you. Serious. Serious. Fuck you.
That was racial trauma. And that was just a small segment of the kinds of racial trauma that happen every day in our country that perhaps we never see or not aware of, but that the people that many of us work with encounter every day of their lives. And so the question then becomes, how do they in fact survive an existence in which trauma could happen at any moment? What you saw was what my colleagues Carlton Green and Gerda Nicholas and I call direct cataclysmic events. It was clear, I think, from the video that the events you saw were life-threatening. In fact, you saw people die. Life-threatening cataclysmic events or things that happen to oneself, or they can happen to people who look like you. Just watching that video, for example, can be traumatic for many of us in the room. It's certainly traumatic for me. In our society, we recognize the existence of hate crimes, but very few hate crimes actually come to legal action. And so, although as clinicians, I suppose if someone comes in complaining of these kinds of events, we might take them seriously. It's not clear to what extent the people even realize that these are the kinds of issues for which they should seek mental health treatment. The other kind of direct cataclysmic event are events that are related to race with respect to naturally occurring kinds of incidents. For example, when Hurricane Katrina happened in Louisiana, I think many people who worked with trauma victims were able to recognize that losing everything in your life, your property, your home, your sense of safety was traumatic, but they didn't recognize the extent to which how you treat the people who were having those experiences matter. Many of the Black people in those incidents, for example, talked about how the Red Cross treated them badly. It treated them with discrimination. It treated them as if they had caused their situation. If you looked at the newscast describing people breaking into stores to get food treated them badly. It treated them as though they would not have broken into whatever place they could to feed family and friends, given that they waited forever for someone to come and rescue them from those settings. So direct cataclysmic events may be what actually happens to the person. It may be how the person is treated with respect to things that happen to them. Events may be vicarious cataclysmic, such as witnessing events. Chances are, for many people, witnessing the kinds of events that I showed may trigger reactions that they have buried or that they didn't know about, reactions that tie them with a history of oppression. So that many families, for example, particularly mothers, socialize their African American and Latino sons to expect police to treat them in violent ways. And so they teach them anticipatory coping skills. They teach them, for example, that if they're driving and they get stopped, they have to put their hands on the steering wheel, because if they don't, they're likely to be killed. And there are all sorts of these kinds of rules that happen not because the mothers, the fathers themselves have been victims of these kinds of incidents, but because they know the racial history. They know that groups can be mistreated, and they know that the legal system, the political system, focuses on men and women, boys and girls in particular kinds of ways. Racial microaggressions, or what I've been talking about, is the everyday kinds of events that cause one to recall the past or to wonder about one's sense of self. Racial microaggressions are the kinds of things that build up and lead to strong stress reactions. When I was in New York for my niece's wedding, I was at Penn Station trying to get a taxi at 1 p.m. in the afternoon. 4 taxis came up to the line at which I was at the head of the line, and they all suddenly had to take off because they'd been working all day, and so they wouldn't pick me up. I kind of felt sorry for the dispatcher because he kept traveling from taxi to taxi with my bag, trying to find a taxi that would take me to where I needed to go. That's a racial microaggression, and that then recalls all of the different kinds of microaggressions that have happened in my life, but also that have happened to people I know. Those are stressors. So here's our problem. As practitioners, researchers, teachers, we really haven't been trained to recognize or to diagnose or to treat the kinds of symptoms that people develop in response to racism or ethnoviolence. We just don't consider them as potential sources of mental illness or physical illness. And because we haven't been trained to deal with these kinds of issues, what often happens is that when people come in who need us to treat them for trauma, we actually might end up re-traumatizing them by discounting their experiences. The training that we all receive is from the racial ideology of white society. That is, the rules by which we can discuss race, the rules by which we can discuss race and trauma, the rules by which we can diagnose, are all defined by the dominant racial group, which does not have these experiences in the same way as people of color do. So one of the things I've tried to do in my work is to help people understand the lenses through which we react to race, in hopes that it will lead us toward better treatment with respect to these kinds of events. I call my perspective white racial identity theory, and I want to talk about that some. How are we doing? Am I okay?
No, you're fine.
Can you give me a sense of how?
You got another 20 minutes.
Okay, I'm going to talk about this some. When you looked at the excerpt that I showed you, you actually perceived those events in different ways. Some of you probably shrugged it off and said, what does it matter to me? Some people probably felt guilty. Some people probably thought, well, they must have done something to deserve what was happening to them. in some way you perceived this event in different ways. What racial identity theory, my racial identity theory, tries to do is to help us to see the lenses through which the dominant society recognizes and copes with racial issues. And so I'm going to talk about it in terms of individuals or people, but recognize that this also pertains to the way that society interacts with respect to issues of race. I think about racial identity as the eyeglasses, the lenses through which we see race-related stimuli in our environments, and how we internalize that or incorporate that information into ourselves. And so I think that there are essentially 6 types of eyeglasses or schemas that we might use to interpret events: contact, disintegration, reintegration, pseudo-independence, immersion, and autonomy. Contact and disintegration and reintegration are aspects of internalized racism for white people, for a white society. Pseudo-independence, immersion, autonomy are what I think about as the abandonment of racism schemas or eyeglasses for seeing the world. So I want to tell you, I think, a little bit about what they look like in terms of how people behave. Contact, the first internalized racism schema, I think about as the happy racist schema. It's characterized by satisfaction with the racial status quo. The person who uses the schema can say to himself or herself, racism doesn't exist, and so they can be oblivious to the ways in which they personally benefit from it, and they can also be oblivious to the ways that other people do not. I call this the happy racist schema because in order to be happy or satisfied with the race in our society, you probably have to be oblivious to the ways that in which it functions. People who use this schema, and therefore environments that are characterized by this schema, the people in the environment don't consciously think of themselves as white. The clinician doesn't consciously think of himself or herself as white. And so it's very important for the person, for the environment, to resist thinking about race as an issue. Alana is Boston College for African American, Latino, Latina American, Asian Americans, and Native Americans. I think I got them all in there. The clinician or the person's interactions with Alana's are characterized by naivete and curiosity. I go through lots of different hairstyles. This is my summer ethnic look. My colleagues often want to feel my hair. I do not want them to feel my hair because I don't know where their hands have been. But it's the notion that in some way my hair must feel different from theirs, and so they're needing to explore this difference in much the same way that a baby puts everything in its mouth, I suppose. The clinician also is unaware of racial differences. And so when a client comes in and says to him or her, I think this must be caused by race, the clinician says, well, that couldn't be the case. Let's look for other explanations. In our society, when we say racism didn't disappear after Barack Obama was elected, people say, well, of course it did. We have a black president. So it's naivete, it's obliviousness, it's the, if you will, desire to not interact with respect to the person's racial characteristics. Usually, contact works very well for white people. Remember what, well, you might not have known, but one of the vignettes that was included in the traumatic experience had to do with Trayvon Martin. When surveyors asked people the extent to which they thought the George Zimmerman's trial had any aspects of race, 80% of white people said, no, it doesn't. That's contact, that's obliviousness to the racial dynamics of the situation. It happens, particularly with respect to younger people, that sometimes it's important to deal with other racial groups. And as the person begins to deal with other racial groups, they find that, in fact, what happens in their life is that there are rules about how we interact with people who are from different races than we are. And when that is the case, they develop the capacity to use the schema, the eyeglasses that I call disintegration. This is anxiety, disorientation. It's provoked by racial moral dilemmas. So how can it be that we live in a society that says, in effect, that all men are created equal, but we treat some as though they are not equal? How can it be that if we're standing on the same street corner waiting for a cab and I was there first, that if the cab stops for you, you hop in and leave me standing in the rain, in the cold, waiting for another cab that might take me somewhere? The moral dilemmas. When we do research with adolescents, they talk about the experience of believing their parents when they said that all people are created equal, but then recognizing that when they wanted to date someone who was different, of a different race, that no, people were no longer treated equal. That in fact there were rules about who they could date, and they actually risked losing status in the family by violating those rules. So disintegration people are in a place of confusion. Either they defy the white socialization rules, or they defy, or they in effect accept the notion that they are going to violate their moral rules. So, characteristics of disintegration. People become aware that they can be kicked out of the white group. My graduate students talk about when they go home, how their parents warn them not to talk about this race stuff when their rich Uncle George is there, because rich Uncle George might not leave them any money. The clinician often feels anxious because we don't teach people how to bring up the topic, and so when the topic comes up, we don't know what to do about it. The white clinician in particular begins to recognize that his or her whiteness has value. And often there's a sense of recognizing what the quote-unquote right thing might be to do in the situation, but also recognizing that one doesn't want to do it, that it costs too much. Someone asked me about what I teach, and one of the things I teach is history of psychology. There were lots of choices where psychologists could have made moral choices. And so I ask my students, well, would you have made the right moral choice in this situation? Brown versus Topeka, for example. And they say, no, I wouldn't, because in effect, I don't want to lose the advantages that I get by not dealing with the racial issues in my environment. I know what you want me to say, but I'm not going to say it because I wouldn't do it. And I, of course, reward honesty, even if I don't like it. Disintegration is uncomfortable. So people often resolve that by resorting to using their contact schema, or they may, in fact, begin to use the reintegration schema. Our country, I think, now is in the midst of using its reintegration schema. That's the idealization of the white group. It denigrates all other groups, especially people of color, and it turns people who are white but not idealized white into people of color. So for instance, many politicians talk about the poor and how we have to send the poor out to work, how we have to starve the poor by getting them off food stamps. When they say poor, they in effect mean people of color. They mean blacks and Latinos. When in actuality, most poor people are white people. And so they're acting as if when they starve people of color, they're not also starving white people. And somehow that dialogue does not happen. Maybe if it did, they would recognize the moral dilemma of treating people as though in the quote unquote richest country, or at least the richest 1% of the country, treating people as if it's okay for them to starve because it's their fault. Characteristics of reintegration, idealization of the white group, especially idealization of the white group and denigration of other groups. There's a tendency to be intolerant towards certainly people of color, but also quote unquote white liberals. If you're using the reintegration schema, you have to get the right sneer in your voice when you say white liberals. The person believes that he or she is innately better than people of color because he or she is white. One of the reasons why Obama is having such difficulty in terms of race relations with respect to many of the Tea Party and friends is because many white men believe that he is in an office that rightfully belongs to them. Why do they think it belongs to them? Because they are white. As you saw in the vignette, the White House was designed for white men, and so therefore they're upset. When one is using this schema, one has positive stereotypes of whites, like oneself, and negative stereotypes of people of color. And so you kind of have to pass a test in order to be accepted into the white group. You can't be just any old white person. You have to be one that holds the values and customs of the person who's using reintegration. We see that a lot in the loyalty test, if you will, that the Tea Party is engaging in at the moment. Anger and hostility is directed towards people of color. Can't talk about racism with the person who's using the reintegration schema. Reintegration also works. People who use the reintegration schema can, their whole lives use the reintegration schema. They can marry reintegration people and have little reintegration children, and society will not think badly of them. In fact, if they really want to, they may get to be on the Supreme Court someday. So reintegration works in this society. But sometimes on an individual person-to-person level, the person may need to begin to resolve the issues of the moral dilemma. They may need to begin to think about, how do I exist in a multiracial, multi-ethnic kind of environment? When that happens, the person begins to develop the capacity to use the what I call the pseudo-independence glasses. So these would be the first steps towards developing, overcoming internalized racism. It's where the person has a commitment to the white racial group, but they are tolerant, if you will, of Allynness. And they believe that it is their responsibility to help people of color achieve better status. People of color usually really like people who can use a pseudo-independence schema, because even though what they're trying to do is to help the person be more like white people, they at least are not using negative slurs and stereotypes in order to characterize the people, or at least not on purpose. Most of the affirmative action activities comes by way of white people who could use the pseudo-independence schema. So they can talk about the principles of racial fairness, although they may not live by them. It's not in my history class, for example, all of my students talk about how it's really important to improve the quality of schools in Massachusetts. So when I ask them, would you improve the quality of schools by sending your children to those schools and improving them from inside rather than outside? They say, of course not. So they can articulate them, but don't understand the implications of what that means. People who use these schemas believe that whites and white culture are the best, and therefore Allynness can be helped to reach the higher standards. One of the terrible efforts in our society has to do with standardized testing. People believe that standardized testing, if you can get people of color to score as high on standardized testing as whites do on average, then we'll solve the racial achievement gap. In fact, I talk about testing in our society as being a legalized form of apartheid. It's a way that we can justify why we separated people. The pseudo-independent person, when they're using the schema, feel a responsibility for helping people of color become more similar to whites. People should aspire to be like the best white person they know. And people who use this schema talk about or think about people of color as being the experts on race or racism. I get invited to do lectures on racism in my colleagues' classes, which I usually resist. And when I ask, well, why are you inviting me as opposed to learning about these issues yourself? Well, you're the expert. But I'm an expert who could teach you how to do these courses yourself. And so in many ways, the pseudo-independent person has good intentions, but doesn't recognize that the implications are that he or she needs to develop the capacity to deal with race, cope with race in society too. The good thing about pseudo-independence is that at least people of color will welcome you more than they would some of the early kinds of schemas we talked about. And if one stays in the system, interacting with people who are different long enough, then one develops the immersion schema. It's the emotional search to understand racism on a personal level, on a micro level, and a quest to define whiteness in different ways. So the person has to re-educate themselves. One of my graduate students calls this the Caped Crusader schema, because when the person is using this schema, race is in the forefront of their lives. And so when you say, how are you today? They will say, what have you done about racism today? So it's at the forefront. The person who can use this schema can assume personal responsibility for racism. They're able to notice both positive and negative aspects of their race as well as the races of other people. They think about themselves as being more knowledgeable about racial matters than most white people, and they are, but nobody likes a smart aleck. And so what often happens with respect to immersion people is that they get excluded, they get radicalized. People begin to think about them as the one who's going to always bring up the racial issues. Very often then what this means is that the person who can use this schema, their best friends are people of color. The problem with that, of course, is that that means that they've abandoned the group that is most in need of their services. And so I encourage my students that when they recognize that they are using an immersion strategy, they not only need to associate with people of color, but they need to also invest in re-educating some of their white peers so that we slowly change the system so that it's more responsive to racial issues. And then as one begins the self-education, one perhaps develops the capacity to think about race and racial issues and racial trauma from a more humanistic perspective. Which I think about as autonomy. Here the person develops their own standards of what it means to be white and what it means to be not racist in a racist society. Here the person begins to develop their own standards for how they will relinquish privilege and how they will teach other people about privilege. Here the person begins to view race-related situations from many different perspectives. The person accepts his membership in the white group. Often when I do workshops on racial identity, white people have trouble saying that they are white. So when I ask people, what race are you? They will say, I'm a mongrel, or I'm not a racist, but they will rarely say, I am white. When a person is using the autonomy schema, they can do that. They know that in this society, that's how people are classified, and that it doesn't necessarily mean anything about you. What the classification means is that other people may perceive it as meaning something about you. A person who can use this schema has a personally meaningful, non-racist standard of whiteness, and they recognize that to be autonomous, to use the autonomous schema in this society means that you have to keep changing as racism changes in the society. It changes with each big event in our lives. People, for instance, talk about the election of President Obama as beginning the post-racial society, but it didn't really do that. And so then the person who can use the autonomy schema begins to ask, well, what happened to it? It surely didn't, 200 or so years of racism surely didn't disappear in 4 or 5 years. And so they began to question their own standards of what race means, and they began to question how society is dealing with race. People talk about hating Obama. They don't talk about hating his policies. They talk about hating the man. And many of the people who talk about hating the man are religious people. It's always perplexing to me that reporters and people who cover these kinds of groups do not ask them, why do you hate him? But rather they assume this as a fact of life. The person who can use the autonomy perspective would be able to ask that question. You rarely would find a person who uses autonomy or can use autonomy in an all-white environment as a way of life. They want to include diversity in their lives. And they don't depend on people of color to validate their non-racist status. People often ask me, Am I a racist? You would think they'd know better than to ask me that question, but they do. And my response is usually, that's not really for me to decide. The autonomous person answers that question for him or herself. And the person who can use this schema recognizes that it's an ongoing process. Sometimes when I do this presentation, people will say to me, well, I always use autonomy. Anyone who says that to me, I'm not likely to believe, so I'm giving you warning. Because it's an ongoing process. It changes with the environment, and so a person has to continually be working on those issues. Okay, those are the 6 types of eyeglasses. Summary of how they pertain to discussing racial issues. The contact person doesn't want to talk about it, and so they don't. When I listen to tapes of my supervisees, I can hear them avoiding the topic, and they will usually say, I don't know how to bring it up. Disintegration, confusion. People don't feel safe enough to talk about race, and they often check out of the setting when such conversations happen. Reintegration, power is in the race, and so they definitely don't want to talk about race, and anyone who talks about it is accused of playing the race card. Diagnostically, they're often talked about as being delusional or hypervigilant with respect to race. Pseudo-independence, intellectualized acceptance. Many people who use the pseudo-independence schema believe that racism doesn't exist in the younger generation. And so what they say to me, what they say to society is that, well, that existed in our generation, but the younger people don't have that problem. They have friends of all kinds of colors. If you looked at the vignette that I showed you, those were younger people. Younger people have the issues. It's just that we want them not to have the issues, and so we don't talk about these things with them. Immersion, acceptance of personal responsibility. And so when one recognizes that race is in the room, if one can use the immersion schema, one brings it up, even if they don't know how to do it correctly. They take risks. And then finally, autonomy. The person really wants to consider how race influences their situation. So you probably want to know what all of this has to do with spirituality or religion. Other than the moral dilemmas, which are a theme throughout, 2 principles might help you to think about these kinds of issues. One is that researchers have shown that multiracial congregations, church congregations, are rare. I think it was maybe Martin Luther King who talked about the extent to which churches were segregated on Sundays, so that white people went to one church, black people went to one church, Asians go to one church, and so on. And in fact, congregations that go out of their way to attract members of different races typically cannot sustain that multiracial composition. And so we are often in worshiping settings in which we don't really interact with people who are different races from ourselves. And so we don't get a sense of their humanity. We don't get a sense of where we overlap with respect to each other. The second principle to think about is called the religious congruence fallacy. It's this assumption that however we practice our religion, so our beliefs, our attitudes, and our behaviors, necessarily generalize across contexts. So if we are kind and thoughtful to people in our church, that must mean that we are kind and thoughtful to people who don't look like us, who are outside of our church. Well, that actually is not true. And we know that particularly it's not true with respect to what society calls race. Very often the people who describe themselves as most religious, the fundamentalists, engage in the most reintegration kinds of behaviors when they come in contact with people of color. So what they in effect are doing is they're practicing the principle of fairness and equality when they are interacting with people who look like them, but that disappears when they are interacting with other people. And so what I'm hoping to do is to suggest that, particularly with respect to spirituality, that we begin to think about how can we fuse our religious identity with our racial identity so that, in fact, we move forward towards a more transcendent, if you will, view of how race operates and how we treat people who are experiencing racial trauma in our environment. That's what I have to say. Yeah.
Hi, thank you very much, Dr. Helms, for your presentation. I was wondering if you've done any work about the intersection of racial identity development and religious or faith identity development.
I have not, but some of my graduate students have, which sort of, in many ways, is why I'm aware of the conflict between a religious identity and racial identity. In fact, many people who one would see as developmentally progressed with respect to their religious identity are not progressed with respect to their racial identity.
Hi, doctor. Would you suspect any reason why the point the multicultural, multiracial congregation wasn't really sustainable?
Yeah, because people don't recognize the extent to which the environment has to change in order to welcome people who are not like the dominant group in the environment. So you can't just say, come to my house and be like me. You have to recognize that the people bring characteristics to the setting that the setting should value. And so they don't survive because people don't really get integrated into the system.
Dr. Helms, I wonder if you might comment on, since we're talking about trauma today, I wonder if you might, and you were speaking earlier about the chronic trauma associated with racism, cultural racism. I wonder if you might comment on how chronic trauma might contribute to the lack of contact between folks who have experienced that kind of chronic trauma and those who may have not.
People experience different kinds of trauma, if you will. There is, in fact, a white racial trauma, and it goes like this. I don't think I did anything bad in my life, but whenever we talk about these issues, I feel like I did something bad in my life. So therefore, because I don't like feeling bad, I'm not going to interact with people who make me feel that way. And so the context, it's avoidance, which is a post-PTSD symptom. So the contact doesn't happen from the perspective of the white person because either they feel like they don't have the skills or they feel like they're going to end up feeling bad in the situation, even if that wouldn't be the case. The contact doesn't happen for people of color because in some sense they often are in settings where they don't have the power to make contact happen. You can't say to someone, I want you to associate with me and be assured that that's going to happen. It really has to be a change in the power system, the power dynamics of the environment. So people often ask me, for instance, why do the black students or the Latino students or the Asian students all sit together? And I typically respond to them, well, why do all of the white students sit together? In these predominantly white environments, It actually is the white people who would have to make the move to say, in effect, you're welcome in our environment.
Hi. Earlier on, you had talked about, I can't remember which group, asking naive questions and being curious about other groups. I'm a psychotherapist, so when I'm sitting with somebody, part of my kind of routine stuff is to ask about families that I don't know anything about. Is there a better or a worse way to do that? I'm also the only Caucasian in my family. I married into a multicultural family, primarily Asian. So it never occurred to me that I could do it wrong. If you've got a better way, tell me, because I don't know otherwise.
Let us start with don't ask to touch my hair. but more seriously, two things. People of color are usually accepting of people who use the contact schema, even if they don't ask the questions as well, because it's the intention that's the issue. So I can say to you, no, don't touch my hair, but I also then recognize you as a person who at least is acknowledging that race is in the room. I also think it's important not to think about it as being a right way to do things, because who knows what the right way is. The issue is to do it. And in doing it, then one can interact with the people you're interacting with and get a sense of whether there are ways that you should change how you interact with those particular people. So don't say, I'm not going to do it because I might do it the wrong way. There's no wrong way to do it. Well, within limits, no ropes or things of that sort, but in conversation, there's no wrong way to do it.